that's a great point. And in my opinion, I think we're a way over-medicated society. And when we talk about colds in particular, colds is a virus for the most part. There's many different types of viruses, adenoviruses, and others such that antibiotics don't treat these.
Right.
And when we seek help, when we seek medical treatment for colds, oftentimes the first question I get is, can I have an antibiotic? And the fact of the matter is antibiotics don't do anything. So when we're dealing with colds, then the only thing that we have left is dealing with the symptoms. And at that point, it becomes very, very confusing, because if you look at the cold aisle, it's more than the cereal aisle, right?
Yeah.
And it really comes down to just a few products, really. It's a decongestant, one that decongestion knows you can breathe. There's a cough suppressant, and there's a mucolytic to thin your secretions. And what they do is they just take those 3 items and they mix and match, but at the end of the day, it only comes to those 3 things.
Yeah.
So the first concept is antibiotics don't treat colds for the most part. The second, if you want to, you can treat your symptoms, but you don't have to. There's a reason that you cough, okay? There's a reason that your nose stuffs up. Your body's actually trying to fight infection on its own. And if it's not bothering you, and you can have like a dry cough, especially at night if you're not around other people, and you can cough all that, the secretions that's in your lungs. So what you don't want to do is suppress it so much to a point where you start causing more harm than good.
Right, right. All right, Dr. Lonnie, welcome back, everybody. Our next doctor, we oftentimes refer to him as a marriage counselor, because when you deal with snoring issues and get those taken care of, you save marriages, Dr. Pasha.
That's right. I bring couples back together again.
All right. And the other thing we call him is a detective, because so many of us will medicate our problems and keep going, and it doesn't take care of the issue.
That's
so
right.
That's how you diagnose medicine.
Our philosophy is to get to the bottom line of the problem, so you don't over-medicate, you treat the underlying problem, not just the symptoms.
All right, well, we got to go to the Pasha Snoring and Sinus Center and to see how this detective really works. Take a look. Dr. Pasha, when you say ear, nose, throat, there's a whole lot of stuff that can happen right between here.
Sure. Lot of anatomy.
Okay, so when we say nose, that's the thing that we see on the outside of our face, and a lot of us think that it is just about right here. The nose actually encompasses a whole lot more, doesn't it?
Right. The external nose is only a small portion of your nose. Your nose actually goes this far back. And not only do you have the external part of it, but you have the inside of your nose. And here today we have Ruben. And Ruben is a gentleman who 4 years ago got hit in the nose. And subsequently he's had problems breathing, and he's also had headaches and recurrent sinus problems. So what I'm going to do is I'm just going to show a picture of the inside of the nose. And here is the inside of the nose. This structure on the left is called the turbinate, and on the right is the septum. Now this is the side that's causing a problem. And look, boom, right away. That's bone and cartilage that's completely blocking that left side. He'll need what's called a septoplasty, which is very common. And in his case, it would take 15-20 minutes to do.
What I was first doing, I was recommended to take nasal sprays and antihistamines, and that was just a temporary fix.
Over-the-counter stuff can get you places sometimes, but sometimes people can't just rely on that.
That's right. Most allergy medication is just a day-by-day medication. It doesn't give any long-term benefit. But what we can do is we can test you for allergies, find out what you are so that you can use avoidance techniques if you know what they are. And secondly, we can put you on immunotherapy or allergy shots so you can actually be cured of your allergies. And what Jennifer's doing right now, she's applying what's called prick testing. And what that allows us to do is to find out instantly whether or not she has allergies and what allergen she's allergic to. Angie, can you tell us when you first noticed that you had allergies?
Sure. When I first moved to Houston, I started having watery eyes and a lot of sneezing and things like that.
The typical story, someone comes in, 2 or 3 years later, they start noticing they have allergy symptoms. So what we've done is we've applied all different types of allergens into her skin, and it gives us 10 minutes, and we're going to find out 10 minutes later whether or not she has allergies. Let me show you what we do for the second part of the allergy test, which is once we know that you have allergens, then what we need to do is we need to find out how allergic you are. This is called skin and point titration. This is a much more detailed look at the particular allergens that she has. And as you can see here, this is actually dust mites. So I know that she has a bad reaction to dust mites.
Wow.
From this information, I can now offer her immunotherapy or allergy shots, and I'll give her literally what she's allergic to in small doses so that she can build up her own immunity to it.
Did you have any idea it was dust mites?
No, I had no idea, but I did wake up congested and couldn't breathe when I woke up in the morning, so I think that's what it was now.
So Angie's starting to react a little bit to the mold, and it looks like a little bit of dust and also cat allergy. So this will explain why she's having recurrent congestion. And whenever I have patients that have recurrent congestion, what that really means is that they have inflammation of their turbinates. And if you look over here, you'll see that the turbinates are these fleshy shells that come out the side of the nose. So when you're congested or if you have allergies, in Angie's case, her nose swells up and what happens is her turbinates congest. What we're gonna do is reduce the size of her turbinates so she can breathe a little bit better. And we're gonna do that all today.
Now, when I think of snoring, I don't normally think of a nice, young, pretty lady. But fact of the matter is, it can affect almost anybody.
That's right. And the first thing that we talk about on the show is that the first thing I deal with when I deal with snoring is to find out if you're a snorer or if you have sleep apnea. But with a snore, the big issue is your bed partner.
My husband has told me on several occasions that I snore, so I try to let him go to sleep first before me.
So in Chantel's case, she really had a problem with snoring, but she didn't have the problems with sleep apnea, like witness apneic events where you stop breathing at night, waking up tired, weight gain. She has none of that. So she was considered what's called a primary snorer. When I looked in her mouth, and you can look at the camera here, go ahead, Chantel, say ah. So that little, what people call the bell in the back of the throat, that's called the uvula. And if you can see, it goes way past her tongue, especially when she relaxes. And her soft palate is elongate and it hangs down low. And that is her snoring center. In her case, her elongated and saggy soft palate is what's vibrating whenever she snores. So what we're gonna do today is we're gonna cure her snoring by putting a small implant in order to stiffen up that area so it doesn't vibrate. Now what we're gonna do is go ahead and put the 3 implants in her soft palate. She's already good and numb, so I'm gonna go ahead and place the first implant in. So we'll go ahead and place our implant right into the soft palate with this device. I'm gonna put a third one in. I'll put it on the opposite side, and that will be her last implant. And I'm placing it right into the soft palate, and she's doing fantastic.
So we found out that she's allergic to some things, and now you can do a procedure where she doesn't necessarily have to rely on medications, but on this procedure to free her passageways, if you will.
That's right. In our clinic, we specialize on minimally invasive offer procedures, and one of the procedures that we offer is to reduce the size of the turbinates. And if you recall, the turbinates are what gets enlarged when you feel congested or if you have allergies. So what we're going to do today is I've already kind of prepped her, and we're going to go ahead and just do a procedure in which I can look inside of her nose, and then I can actually, by using the small probe, reduce the size of her turbinates, and it's done very quickly. Okay, and so we're done. So the advantage of doing anything in the office is there's no recovery time. There's no packing in her nose, there's no bleeding. She can basically go back to work the same day.
Dr. Pasha, thank you for showing us these procedures. We know that sometimes in Houston it may not be a matter of if, but when you suffer from some type of allergies.
That's correct, and it's always important to note that we shouldn't just treat the short term, we should look at the long term and treat the underlying causes of sinus, allergy, snoring, or any sleep-related disorder you may have.
Yeah, because a lot of us were like, just make the symptom go away, we'll be fine. But sometimes long-term medical use or medicine use and things like that can just add to a problem.
That's right, and that's a good philosophy for medicine in general. If you can treat the long term, that's much more important to treat the cause than the actual symptom.
Okay. Thank you. And word of warning from Dr. Pasha, he says spring allergens are going to be early this year. If you're suffering from sinus, allergy, or snoring problems, call Dr. Pasha's office at 713-523-8800, 713-523-8800, or find them online at pashamd.com, and that is for the Pasha Snoring and Sinus Center. Coming up, want to find out how